Hey, everybody, and welcome. Today, I've got Dr. Joshua Sharfstein. He's the Vice Dean of Public Health Practice and Community Engagement at Johns Hopkins University. And he served as Baltimore City Health Commissioner from 2005 to 2009. Also joined by Dr. Letitia Dzirasa, the current Baltimore City Health Commissioner, and they are both practicing pediatricians. Welcome.
Thank you. It's been a little while since I practiced, but I appreciate the credit. I practiced at home with my 6-year-old. Let's say that.
I'd say the same thing. I'm a card-carrying pediatrician, but it's been a little while since I practiced.
Once you get it, you never lose it. So I'm going to give you credit. All right. So let's get started. The reason that I have the two of you on, is because we've seen an alarming, frankly, spike in infant deaths. Public health officials say that these are preventable deaths. Many of them are sleep related. So, Dr. Sharfstein, it's my understanding that you have a history with this issue. Can you talk a little bit about what Baltimore City and the region's um, history is and past is with infant deaths and some of the initiatives that have been started to reduce those deaths?
Sure, thanks so much for having me, and it's so great to be here with Dr. Dzirasa. I was health commissioner when there was a huge surge in infant deaths. Baltimore had some of the highest rates in the country and enormous disparities between Black babies and white babies dying in the city. And one of the major reasons was unsafe sleep. And I remember doing a press release. I think close to 30 babies had died in unsafe sleeping arrangements. And if I recall correctly, nobody covered the press release. And that was one of the worst days I had as health commissioner. And I thought, how can we do more? How can we do better? How can we prevent these tragedies? And that was around the time that we began to think about starting Be More for Healthy Babies and really bringing the city together, establishing a broad public health campaign focused on infant health. And the very first topic we tackled there was safe sleep.
Okay, so given the success of the program, the Able Foundation recently put out a report touting the tremendous reductions that we've seen in preventable infant mortality. Commissioner, how do we find ourselves in the predicament that we're in today?
Yeah, I think that's a great question. I do want to very quickly cite some of the data that the ABLE report shared, which was from 2009 to 2019. The infant mortality rate here in Baltimore City went from 13.5 to 8.8 per 1,000 live births. That's significant, right? And more critically, we saw that racial disparity that Dr. Sharfstein mentioned, it was cut in half during this 10-year period. And I think so much of that was the work of Be More for Healthy Babies, which if we think about it, it was certainly the messaging, right? And we're going to talk about the messaging, the ABCDs of safe sleep, but it was also this very intensive community level support with the focus on the communities that we know were hardest hit and most impacted by having excessive number of preventable sleep deaths in infants. And so now, we're 2023. We've been in a pandemic for 3 years. And I mentioned that community level support that Be More for Healthy Babies provided. That includes home visiting. And, that includes really being present and I think walking with and engaging new and expectant families. And as you can imagine, during the pandemic, especially early on, that was a lot more challenging. It was a lot more challenging to go and do the home visits, though we still had the resources, we had the cribs. Those that were maybe less well connected to healthcare or to those supports got even less connected. And so I think that certainly may have influenced it. We do again want to just stress the importance of the messaging, the ABCDs of safe sleep. But I think that at least from a Be More for Healthy Babies perspective, it was a little bit harder to reach families that were already, I think, having a difficult time being reached.
Yeah, I would emphasize that point. I think it's a combination with the pandemic, fewer services and supports, but also a lot more stress, a lot more stress. And, when there's a lot of stress, people maybe want to take the baby to bed with them or, may not be able to go to regular doctor's appointments even. We've seen a decline in immunization. And so it's sort of a perfect storm for infant sleep, which really is why the health department is so right in calling attention to this and seeking the support of the healthcare community in any way possible to turn things around again.
So, Dr. Sharfstein, I think we might have missed this piece, but for the providers in the area that aren't familiar with this program, what exactly is Be More for Healthy Babies?
Sure. Well, it has gone through, a bunch of different phases since we started it in 2009. It is a citywide public health and collective impact campaign with more than 100 partners around the city. Like Dr. Dzirasa said, there are community partners, there are healthcare partners, and it's basically a platform for doing all kinds of great work to support the health of infants and families. And so one of the very first things we did was focus on safe sleep with messaging about the ABCs of safe sleep, alone, on the back, in the crib, everywhere we could put that message, in bus shelters and jury rooms and, the jury trainings and social service offices, on TV, everywhere we could get that messaging. And what we found was that as that messaging campaign ramped up, people actually did better sleep behaviors for their infants, and they put them alone on their back and in a crib. And we saw that big decline in infant-related sleep deaths and sleep-related infant deaths. And it actually went down from like near 30 down to near 10. And that's a lot of babies saved every year. And that's how you get those statistics that Dr. Dzirasa mentioned.
So, Commissioner, is this something that's acute and specific to Baltimore? Are there national trends that are impacting this issue? And do you also think that that this issue has fallen off of providers' radars?
Yeah, I think good questions. And so when we talk about it, we're seeing a surge really in the Baltimore region, Baltimore metro region. And so some of the numbers we're looking at certainly is what's happening in Baltimore City, but also our neighboring Baltimore County. So we saw really since December 1, we've seen 18 sleep-related deaths. 7 of those are not confirmed yet by the Office of the Chief Medical Examiner, but 18 since December. And that is kind of the peak that we saw 1 year in the past few years. So that's significant. Again, it's combined both Baltimore City and Baltimore County, but significant nonetheless. And so, regionally, we are seeing this increase. Nationally, a study that I saw showed that we had been seeing really a decline in infant mortality. Unfortunately, it's now more increases in youth fatalities. But again, regionally, we're seeing this significant decline. I don't think it's fallen off a pediatrician's radar. We mentioned it's been a while since I practiced, but I also know, when I was practicing, there are many priorities. There are many things that you're trying to talk to parents about, safe sleep being one of them, but especially in that infant phase, you're thinking about eating and you're thinking about childcare. So I think there are certainly many things that pediatricians try to have conversations about. And as Dr. Sharfstein mentioned, perhaps if you're not going to your pediatrician as much, you may miss some of that messaging. So again, I think that's why it is important that we're beginning to really ramp this up on a mass media scale for those families that are starting to get reconnected back to care. But I do think it's on the radar of our local pediatricians.
Okay. So here's a question for both of you, both as current and former commissioners of health and pediatricians. What touch points can providers identify for parents and guardians that could use additional resources? Like, how can their daily practices, how can they modify some of their business practices, intake screenings, et cetera, et cetera? What are some of those touch points where they can say, hey, I think this mom or this parent or this guardian, maybe a grandmother or somebody like that, could really use access to some of these services? Where are some of those places where our local providers can identify this?
Yeah, so Dr. Sharfstein mentioned that this was a partnership, and so 2 of our really critical partners, one is Healthcare Access Maryland, The other is Family League. And so often Healthcare Access Maryland has health navigators to connect parents either for home visiting or to insurance if they're uninsured or underinsured. So Healthcare Access Maryland is absolutely a place that providers can refer to. I think for our obstetric providers, we talk a lot about our pediatricians who are important, but for our obstetric providers, also making sure that mom fills out that prenatal risk assessment. So one of the things that BHB, Baltimore for Healthy Babies, advocated for was this required prenatal risk assessment because that's often serves as the trigger to connect families into care and additional support. So I would say that to both on both sides, those are places that providers can go.
Well, one question for you, Dr. Draza. Do we still have the program for free cribs if people need a crib in Baltimore?
We do. So we'll get that number out to providers. Healthcare Access Maryland, again, is often the partner providing that resource. Their number, 410-649-0521. But yes, we do still provide those free, safe sleeping environments.
I think that's really important because, every family in Baltimore has access to a crib. It's easy for people to say, make sure you put your baby alone on their back and in a crib. But if there's no crib, the person can't do that. So the fact that the city has had this program, which started with Be More for Healthy Babies, I think really is an opportunity, and every provider should be thinking not just about how to give advice, but how to link families to the resources that they need to be able to follow that advice.
Okay. And so, Commissioner, do you expect COVID and RSV to continue to impact this crisis? What kind of advice are you all providing to parents and providers?
Yeah, so we did see of those 18 infant deaths that I mentioned, there was a handful of them where the child had some respiratory symptoms, whether it was because of RSV or COVID, more RSV actually. And so, we do know that upper respiratory infections, combined, with some of those safe sleep practices do increase the risk. And so I think again, our providers are generally mindful of that, but keeping that in mind when you're seeing that infant coming in with the URI symptoms, maybe it's also a time to do the gentle reminder around what safe sleep looks like, especially in the case of an upper respiratory infection.
All right. So the last question to both of you. We talked a lot about peds. We even mentioned obstetrics. Do you have a parting message for any of the providers that aren't in those fields that need to know or keep up with or be aware of the 18 deaths that we've seen in the region in just the past few months? As we've stated, these numbers are alarming because they are higher totals than some of our previous years combined. So if I'm in emergency or if I'm in podiatry or something like that, where are these opportunities for other providers to be aware of what's happening in the city, tuned in, and allowing them to be able to refer out or connect patients with resources?
Well, I would maybe just jump in to start and say I remember when this whole program got started, one of the insights was that people get information about infant care from many different sources, and so that includes grandparents and that includes family members and community members. They don't only listen to doctors. I know that may come as a shock to some doctors, but they don't only listen to doctors. And so, particularly grandparents can be pretty important, right? Because the parent may turn to their parent and say, "Hey, what do I do?" And if the grandparent's there to say, "Hey, they're the ABCs of safe sleep," then that helps a lot. So I think it's good for healthcare professionals generally to be aware of this, to know what's going on. If people are talking about their grandkids, to say, "Hey, you followed this challenge of unsafe sleep in the city and some a surge in infant deaths, and it's really important, alone on their back in the crib, and there are resources that you can connect to. You can just go online and look at Be More for Healthy Babies. You can call healthcare access. But it's possible for a podiatrist to save a baby's life, believe it or not. by talking to the grandparent.
Yeah, I completely agree with Dr. Sharfstein. Any opportunity that you're engaging with someone, it seems like we all know babies or have babies around us and in our lives. So I think that's an opportunity. One thing that I thought about, even as you asked that question, was also messaging for our daycare providers. Obviously, this is very focused on healthcare providers, but thinking about children who are in daycare and take naps in daycare, right? And so also making sure that we're pushing this message out to kind of that set of child care providers, in addition to other family members, that our daycare providers are also aware of this trend as they're taking care of infants in their respective spaces.
Okay, well, thank you so much, commissioners. We appreciate your time, and this is an important message, and we hope that if you have any questions, please feel free to reach out to the health department. We are here and available to answer any and all questions and get you connected to the resources, or your patients connected to the resources that they need to lead happy and healthy lives. So thanks again for your time, everybody, and we'll talk later.